Okay, welcome everyone. So my name is Jason Pei-Shiue Tsai. So I'm from the vet school. Thanks everyone to participate in this class. So I'm the first lecturer for this class. So today mainly we will be talking about period. But don't worry about the content of this class because for the first few classes we will talk about more biology, more medical aspects of the period. But even though if you are not in the same field or similar field, if you do not understand anything, don't be hesitated to contact me or to ask any questions. Even during the class, even when I'm talking about something, if you don't understand, you can always raise your hand. Or even come to me after the class, okay? So don't be hesitant. And I will try my best to explain everything in a relatively simple and easy understanding way. So the most important thing is what is period? So I think today we are going to talk about the period that you know, but mostly will be something you don't know, okay? Because period is a phenomena that contains a lot of things, not only about what you see, but also about some knowledge behind it. Why that happened? And does everyone the same? Does the same phenomena across the different animal species? Okay, so this is probably the most important thing that I would like to talk about for this whole lecture. Okay, so the first thing is I would like to get a little bit of feedback on what the first word that pops up in your mind when you think about period. Okay, so please take your phone and then scan the QR code and then go to the Slido and ask the question. Period. 这是直接翻译, is that right? Direct translation. What do you think about period? Oh yeah, 一段时间. Right. But that's good. Okay. Want to participate? Okay, last 20 seconds. Okay, last 20 seconds. A sanitary pad, yes. We will talk about this later. Sleepy. Yeah, sleepy is tricky, you know. When you have the class at 8 o'clock in the morning, you feel sleepy. Me too, right? All right. So, okay, let's let this continue. Okay, so as you can see from the questionnaire, okay, so blood is actually the first thing that everyone think of. Okay, so like blood, red, they are quite similar. Okay, chocolate is a little bit different. So if you combine like blood, red, this blood together, this is actually the first word that pops up in your mind. But it's reasonable because this is what you observed mostly, right? Or what you see mostly. Okay, so this is very common. But what we would like to tell you in the following lectures is that does this really means the same for all the animal species? You see the blood, but does that mean that it's a regular normal period, or is it an abnormal period? Is it the same when you see the blood in your dog, your cat, the chimpanzee in the zoo? Are they the same? Do they have the same meaning? I mean, you do see the blood, right? But that could be different. Okay, so this is what I'm going to tell you. Okay, I'm going to switch back. The most important learning points of today's lecture is that I want to tell you the similarities and differences between menstrual cycles in human and also something I call menstrual-like cycle in other animal species. But the important thing is whether all animals has the period like human, or there are also differences between different animals showing the similar phenomena like period. This is something that I hope that when you walk away or when you walk out the classroom, you will know how to differentiate them. So similar observation like bleeding, this is the first word, the blood that everyone pops up. Okay, so bleeding at the reproductive tract, the same phenomenon or the same observation, but do they mean the same physiological meaning? Do they have the same physiological meaning? Okay, so knowing the differences is very important. Knowing the unknown is important. So here I took two extreme examples for you. So for example, you can see in this picture, a lady holding a rabbit. These are two very different or extreme examples. For example, in rabbits, rabbit is the species that does not really have a regular cycle or does not have a regular period, but can accept the mating at almost all the time. However, in human female, they do have a very regular period. Well, I mean, if it's normal, okay? A regular period, but cannot mate or cannot accept mating all the time. So these are two very different examples. But why? Okay, so before we talk about why, first I have to tell you what is period. So let's define period in the medical or biology term. So period is a series of changes on endometrium and your physiology under the influence from both ovary, and also hormones. Okay, so the important thing over here is that you have to know or you have to remember period is a consequence, it's an outcome, 结果. It's an outcome from what? From the effect of ovary and also the hormone. And the affected tissue or the affected organ is the endometrium and also your physiology. For example, during the period, you will see the changes of the endometrium, and also you will see the changes of the body temperature. And all these changes in red came from a series of changes from ovary and also from the hormones. Okay, so first you have to separate two groups of things. One is the cause, the other is the consequence. And then when they link together, that ends up or that results in the period you observe. Okay, so this is the first thing that you need to know. So what regulates the period? Because I say, okay, period is what? Period is the end result of the endometrium changes and your physiology caused by ovary and hormone. But what regulates this process? What controls the period? The most important controlling axis is the hypothalamus, pituitary gland, and also your target organ. But what is hypothalamus? Hypothalamus is an organ or is a part of the organ just underneath the midbrain. Okay, so if we enlarge the structure, you can see that this part, so here is the brain, okay, on the top is the brain. Here is the hypothalamus in red over here. So this part is the hypothalamus, and this part is the pituitary gland. We say 下视丘 here, the hypothalamus. 脑下垂体, pituitary gland. Okay? And pituitary gland, if you separate anatomically, they have two lobes. The anterior pituitary gland that is responsible for the hormone secretion. And that will affect how you feel or your body changes. For example, temperature rises, your mood, how you feel, everything controlled by the anterior pituitary gland. And the other part is the posterior pituitary gland that is responsible for neuron transmitter. And that's nothing to do, or at least at this moment, nothing to do with the changes of the endometrium. Okay? So the important thing that you have to remember here is that the controlling of the period came from hypothalamus, affects the anterior pituitary gland, and then the anterior pituitary gland will secrete different kind of hormones that affects your endometrium and your physiology. So the affected target. So when the anterior pituitary gland secretes some different kind of hormones, it will affect, or it will take the effect on the ovary. And then we'll talk about what the changes on the ovary at the later slides. I say hormone is very important. Okay, so hypothalamus will secrete a hormone called GnRH, so gonadotropin releasing hormone. And this GnRH hormone will affect anterior pituitary gland. Anterior pituitary gland will then secrete FSH, we call it follicle stimulating hormone. Okay, so like this, follicle stimulating hormone, FSH. And this FSH will then act on the ovary to allow the growth of the follicle, right? Follicle stimulating hormone, what does that do? Is to stimulate the follicle growth. Yep, okay. And then when the follicle grows until a certain maturation stage, it will ovulate. After the ovulation, the rest of the ovarian tissue will become another structure called corpus luteum. And then corpus luteum will then secrete another kind of hormone called progesterone. This progesterone is one of the most important hormones that cause the changes on the thickness and also the blood flow on the endometrium. Okay, so although the control is like this cycle, but one of the most important hormones that controls the height or the thickness of your endometrium and whether you will have the period or not, that's something to do with progesterone. Yep. So no matter your physical appearance, it doesn't matter about your physical appearance as long as you have this functional acid like this, you will have the period. However, as I said, there are so many different animal species. There are so many. Yep. So does everyone has the period? Okay, I say it doesn't matter about your physical appearance. If you are very strong, if you are very skinny, it doesn't matter. However, how about animals? Does that the same? Okay, so here's another question I want you to ask. So please scan the QR code and let's see what the answers is or what the answer is from everyone. Okay, so our question is, which species has period? Okay, let's see. Let's see the answer of everyone. Okay, let's see. So here is almost the result. I don't think it will change a lot. Okay, so about 20% of you guys or you ladies say whoever. Okay, so let's repeat the question first. So the question is, which species has the period? And the answer is, from everyone, about 20% of you said, whoever has the ovary will have the period. Okay, okay. So why do you think this is not correct? Does anyone want to say anything? Okay, yes, please.
Because I know that something come out from the body is a part of the uterus. So it must be the important part.
Okay, yes. So remember the concept I just mentioned. Okay, so what is period? Period is we have the cause and the consequence. So the cause is the changes of the hormones on the and the effect on the ovary. And there's a series of changes on the follicle growth that will cause the changes of endometrium, right? So you do need your uterus to result in the period, right? So if you only have the ovary, but does not have the uterus, you will not have the period. That will be the same as this one. Whoever has the uterus will have the period. Of course not, because the cause is what? Pituitary gland, hypothalamus, pituitary gland, your ovary, and then effect on your and your uterus, right? So these are the whole package that you do have to have. So about 60 or 70% of you ladies or you guys say whoever has the ovary and uterus will have the period. Okay, this is also not exactly correct, or at least it's not the really correct terminology. You do need to have the functional ovary and responsive uterus, then you will have the ovary. Okay, then you will have the period. If you have the functional hypothalamus, if you do have the functional ovary, but the uterus is not response to any of the hormone stimulation, then you will not have the period. However, if you have the functional uterus, but your ovary is irregular, so it's not secreting the hormone it needs, then you will still not have the period, right? And I think there are 10 students are quite honest to each other, so who cares? I'm already thinking about what I'm going to eat. Yeah? That's good. All right. So the important concept here is that, yes, the cause is from your brain to ovary and then to uterus. But all of these parts needs to be functional, responsive. Then you will have the period. Yep. Okay, so which species has period? I already mentioned, does everyone has the period? Yes or no? And apparently the answer is no. Okay? So first of all, you need to be, we call it 生理女, right? You need to have the functional ovary, functional or a brain, ovary, and also the uterus. These axes need to be correct. But still, not all the animals has. For example, later I will talk about only most of the primates, for example, like human, chimpanzee, bamboo, orangutan, gorilla. These we call old world monkey. These primates will have the period. For the rest of the animal species, they do not have the period. So human female, mostly they experience their first period around puberty or after the puberty. So it's about 10 to 11 years old, and sometimes some ladies are a little bit late, so from 15 to 17 years old. But it's about this age. So at the puberty, when human female reaches the puberty, then you will start your period. That's the normal situation. And most of the non-human primates, they reach their sexual puberty. It's also quite similar like human beings, around 10 years old. However, these non-human primates, they will start their first period in the relatively late stage. So human female starts their period at puberty and then continues until like 45, 50, or 50-something years old, and then they stop. However, for most of the non-human primates, like chimpanzee, orangutan, or bamboo, or gorilla, they will start their first period at a relatively late stage. It's not associated with their puberty, and also is most affected, and they will last for longer period of time. So most of these non-human primates, they start late, but last for longer time mostly until they die. Okay. But also, like when human female reaches the puberty, so there's a reason behind this, why a human female have the puberty that is associated with the puberty, and why non-human primates, they do not. The reason is because human females reaches the puberty, at that time, their hormone secretion, the follicle stimulating hormone and also the luteal hormone, the secretion is relatively stable and regular. And that controls a regular period in human female. Okay? However, in most of the non-human primates, when they reach the puberty, their serum level, So their FSH and this LH, luteinizing hormone, in their blood, there's a lot of variations. So it's not stably secreted like human female. And these great variations varies between different species. For example, chimpanzee will be different from gorilla, will be different from orangutan, will be different from bamboo, okay? And then this will also be affected by the environmental factors. For example, here, I say non-human primates lives in the wild will experience their first period relatively earlier and last for a longer period of time if you compare to the captive animal. So the same chimpanzee, the same species, if you put this chimpanzee, for example, chimpanzee Jason, for example, if you put this chimpanzee Jason in wild, then I will experience my first period relatively earlier, and it will last for a longer period of time. However, if you put me into the Taipei Zoo in the cage, then my period will start relatively late, and then will last for a shorter period of time. So for non-human primates, their period is not only affected by the serum level of the hormones, but also affected greatly by the environmental factor. And that has a reason, because unlike humans, for these wildlife species, they need to find a way or the best opportunity to extend their chances for reproduce their offsprings. So they need to, if they are in the wild, they need to be ready as soon as possible, and then have the period as long as possible to be able to have their offsprings. Because in the wild, you may meet your perfect man once in a year, and you may not meet any perfect chimpanzee, during your lifetime. So they need to be ready for almost all the time. So when they meet someone, okay, better than nothing, let's do it. Yeah, and that's quite different from like human females and also from in the zoo, because they don't have this need. For most of the animals in the zoo, if you go to the zoo, you'll see they are relatively, choppy, if I do this way, okay? And because they don't have the need for reproduce their offsprings, the only thing they need to do is just walk around and then enjoy, right? They don't have the need. So that's why their period will be sort of like squeezed, okay? Oh, yeah, but also, like, if even though they are all non-human primates, but there will be differences between like bamboo, chimpanzee, and orangutan. So it varies a lot. And also at the very beginning, I say for this lecture, what I want you to know is that what are the differences and similarities between human female and different animal species. Okay, so besides the non-human primates, most of the animal species do not have the period. So what do they have? Okay, what do they have? The cycle, or we call period, or the cycle, we call it cycle, maybe to avoid the misunderstanding. The cycle they have is called reproductive cycle, or we call it Astro Cycle, or AKA in heat, 发情, if I say this in Mandarin, okay? So this is quite different from the period, like in human female. Okay, so if we need to define what is period, so now you know, okay, what are the differences between human female, non-human primates, and the rest of the animals, right? But also, what is the period? If we want to really define medically or biologically what the period is, the period can be separated into three major phases. The first is follicular phase. The second is called ovulation phase. The third is called luteal phase. Okay, so for follicular phase, that is the period of time when the follicle is growing from small follicle to a big antral follicle. That's called the follicular phase. It can be long, it can be short. It will be varied between individuals. Okay? And then the ovulation phase is the time when the follicle grows to the maximum maturation stage, and then under another stimulation here called LH, luteinizing hormone, then will leave the entire ovarian structure. So the mature follicle under the effect of stimulation of LH that leaves the ovary. That's called ovulation. And the third phase is the luteal phase. So luteal phase is when, so after ovulation, the rest of the ovary or the ovarian tissue become luteinization, and that will secrete another hormone later we'll talk about called progesterone. So actually, this is one of the very important concepts over here. Period starts way earlier before you observe the bleeding at the reproductive tract. Okay? So most of the time when people say, oh, I have the period, it's because you start bleeding. But actually, that happens over here. That happens over here. But actually, if we need to define the entire period of period, that sounds strange, the entire period of period, right? That will start from the follicular phase, ovulation phase, and also the luteal phase. Yeah, this is one of the very, very important concepts you have to understand. Okay, so about the changes on the during the period. So we separate the changes from different organs. Okay, so during the period, the changes on the ovary is about like this. During the follicular phase, I say the follicle will grow from the primary follicle, very small, immature, to atretic follicle, to secondary follicle, to Graafian follicle. This part of the process is the follicular phase. It can be long, it can be short. Okay? So this part, the growth of follicle, under what kind of effect? Follicle stimulating hormone. Yeah? Remember what I said? So the anterior pituitary gland will secrete follicular stimulating hormone that will make the primary follicle become a Graafian follicle. This is called follicular phase. This is the first phase in the period. Okay, already count into the period, have to remember. And then, when it mature under the influence of the luteinizing hormone, LH, the oocyte will leave the ovary. This is the ovulation phase. Okay? And then after the ovulation, the rest. Okay, I don't care about this one now. Okay, I don't care about the ovary, the follicle now. The rest of the ovarian tissue will become corpus luteum. Okay, another structure. And this corpus luteum will start to secrete progesterone. I'll talk about this in a few minutes. And then we'll start to regress, degrade, and then the whole cycle restart again. Okay, so then this is the change, or these are the changes on the ovary during the period. Okay, as I mentioned, there are three different phases, right? Three different phases in the period. The first is follicular phase. Follicular phase is the growth of the follicle. However, something happened way before this happened, and that is, we call it oogenesis. So the oogenesis is the production of those primary follicles. So if we go back here, so oogenesis happens way earlier. Okay, oogenesis that will produce different numbers of primary follicles. So oogenesis happens before your birth. So most of your follicles on your ovary already there before your birth. And after your birth, the quality and also the number of the follicles goes down, along with the aging. And also the quality become bad. Okay, become worse and worse. Okay, so these are the things. So the important thing I want to tell you over here is that I said oogenesis, so the production of the follicle happens way before your birth. That happens over here. For the oogenesis, there are also three major phases: the replication phase, also the arresting phase, and also the maturation phase. For the replication phase, is the number will changes from the oogonium and then undergo the mitosis. So you have different numbers. You are increasing the number of the follicle. And then it will arrest at this, we call it prophase 1, metaphase, prophase 1 stage. And then this will stop. And then your birth starts over here. When you get birth, the maturation phase is what we talk about, the follicular phase. So if you talk about period, the follicular phase inside the period, it happens at this stage. Okay? Should we take a break first, I think? Yeah? Can we take a break first? Yeah? Okay. Okay. So we talk about that period has different changes. Okay, so we talk about the changes on the ovary, but then one of the most important thing is about the changes on the hormones. So during the period, as you can see over here, during the follicular phase, the most important thing is about the estradiol. Okay, because under the influence of FSH, the follicle stimulating hormone, it acts on the ovary, and that stimulates the growth of the follicles. And then when the follicles start to grow bigger and bigger, it will start to secrete the estradiol. So that's why you see estradiol is increasing during the follicular phase. And then one of the most important thing, the most important hormone that triggers the ovulation is the luteinizing hormone. So as you can see that the ovulation occurs at the peak of the luteinizing hormone. Here we talk about human female or non-human primates, those old world monkeys. Yeah. Okay. Then after the ovulation, because the corpus luteum starts to grow, and then you will see the increase of the progesterones. Okay. So few important hormones that you have to remember during the period. The first is follicle stimulating hormone, stimulate the follicle growth. When the follicle grows, the estradiol increases. Under the influence of luteinizing hormone, ovulation will occur. After ovulation, corpus luteum starts to secrete progesterone, so the progesterone increases. And of course, the most important phenomena you observe will be the changes on the endometrium. So during the period, the changes of the endometrium is like this. During the follicular phase, under the influence of follicle stimulating hormone and also the luteinizing hormone, actually the changes of the endometrium is not really different. It will start to increase a little bit because the blood flow increases, okay? And then upon the ovulation, again, start to increases a little bit. The most changes, or the most obvious changes, is during the luteal phase due to the effect of progesterone. Because if you look at the pattern, the blue over here, the dark blue, the changes of endometrium is almost the same as the pattern of progesterone. So now you know the changes during the period, the changes of endometrium is under the great influence of progesterone. Okay, so this concept is important. So what is called regular period? So most of the female experience a cycle every 24 to 35 days. There are 15% of the population experiences about 28 days. There are a minor population experience less than 21 days. A minor population experience more than 35 days per cycle. Okay? About 20% of the population experience irregular cycle. So their cycle sometimes fall into the normal range, sometimes shorter, sometimes longer, irregular. Okay, and the length of the period depends on the length of the follicular phase. This is important because some ladies, they have a longer period. That's because their follicular phase is longer. It's not because of their ovulation or the luteal phase. It's all about the follicular phase. So the length of the period depends on the length of the follicular phase. Okay, so this is an important concept. And then many factors such as races, whether you are Asian, you are European, whether you are African, these will affect the length of your period. Smoking, overdose drinking, overweight, pressure. For example, midterm is coming. THS, you have to finish the report maybe by tonight, and I still have like 10 different reports. Pressures will also affect the length of the period. And most of the human female experiences their shortest period around 35 to 40 days. So you can see from this picture. So this on the y-axis is the day. So the length of the period. On the x-axis is the age. So you can see that throughout the age is decreasing. The length is getting shorter and shorter and shorter when they are about 35 to 40 years old. And then there will be a slight increase 2 to 4 years before the menopause. Okay, so before the period stops, there will be a short increase. Okay, so this is the human female. However, it's quite different from the non-human primates. As you can see from this image, so in non-human primates, the regular period is quite similar, 20 to 35 days per cycle. However, they experience the shortest period before 20 years old. So you can see that, again, y-axis is the length of the period. The x-axis is about age. So they experience the shortest around 20-something, around here, and then gradually increase when they get older. This is in non-human primates. So this is also quite different between human female and also the non-human primates. And of course, when we do the Slido, the first word or the most popular word is what? It's the blood, right? It's the bleeding. So what is normal bleeding? Okay, so most of the time during the period, if the bleeding occurs in between 4 to 6 days, that's considered normal. But range from 2 to 8 is acceptable. Okay? And most of the time, the regular amount of the blood lost during the first complete cycle is around 30 ml. So what is the idea about 30 ml? It's about 1/3 of the Yakult. Okay, so if you go to 7 and then buy a Yakult, 1/3 of the amount is called regular. Okay, but of course, some ladies, they have more amount. Some ladies, they experience a little bit a smaller amount. Okay, but in between, So sometimes if you have the blood more than 80 ml, that's called abnormal. And you will need to go to the doctor because that's abnormal bleeding. Okay, so most of the blood you observe in the first 3 days of the period. So after, so I will talk about, so over here, so the next one. So actually the period, the bleeding occurs over here. Okay, as I mentioned, the whole period, including follicular phase, ovulation, and also the luteal phase. However, around at the end of the luteal phase, if there's no pregnancy, then the whole endometrium will collapse. And that's the time when you observed the bleeding at the reproductive tract. That's what we normally call, or most of the people call, oh, that's the period. But actually, this is the period. The whole process is the period, rather than when you observe. So you observe the bleeding only over here, okay, at the end of the luteal phase. So as I said, the bleeding or the changes of the period is what? Is the changes on the endometrium under the influence of the hormones. So the affected or the responsive element or the responsive cell is the endometrium, 子宫内膜. Okay, that's the responsive cell. So normally, if the endometrium is inside or at the surface of the uterus, that's the normal bleeding. The blood will come out from the reproductive tract. However, if during the development or other reasons, the endometrium grows on the other parts of the reproductive tract rather than on the surface of the uterus, then you have the irregular bleeding. For example, here are two examples. If the endometrium grows on the ovary, then you will experience this, okay, ovarian chocolate cyst. If the endometrium grows on the muscle layer rather than the surface over here, on the muscle layer of the uterus, you will experience called adenomyosis, okay, 子宫肌腺症. Okay, so there are two different things, but you will see the bleeding, but it's an irregular bleeding or it's a different bleeding from the period. And I'm sure that Professor Ruby or later will also talk in detail on this. Do we observe the bleeding in all species upon period? Nope, only the primates. In this table, you can see, although they are all primates, but some primate species, for example, like this one, squirrel monkey, you will not see the bleeding during the period. And some of them, for example, like macaw, the pigtail macaw, will see a little bit of bleeding. So even though that they are all non-human primates, and maybe they are all world monkey, but the level or the severity of the bleeding at the reproductive tract varies between species. And that's a very different phenomenon from human female. So then you may ask me a question. So I saw a lot of blood appear at the vagina of my dog. Is she having a period? No. Okay, because you may observe in your dog or in your cat maybe not that obvious, mostly dog, you will see this very red edema and maybe a little bit of blood at the vagina of your animal, but that is not period. Okay, because I said in the animal kingdom, only non-human primates will have the period. All the rest of the mammals, all the rest of the animals will not have the period. So during the Astro Cycle, okay, we say in heat, 发情的时候, yeah? During the Astro Cycle of the animal, the capillary at the vagina become hyperemia, so there's increase of blood flow. So that's why they got like this, similar like edema, but it's getting red and bigger and thicker, okay? And then capillary is easy to break, so then that's why you see some blood at the reproductive tract. But that is very different from the period we talk about. So this is different from the bleeding due to the broken down of the endometrium in human. But who cares, right? Who cares about bleeding in the dog? Who cares about the endometrium? Who cares about the period? the important concept is here. On the left over here is the period in human. Although we say, okay, the whole period, including follicular phase, ovulation, and luteal phase. But what most of the people think about period or the bleeding, the appearance of bleeding. Bleeding occurs at the end of the luteal phase over here. However, in the rest of the animal species, the bleeding occurs at the follicular phase. During the follicular phase, because the follicle is growing, because the estrogen is increasing, you see, the follicle is growing, so when follicle grows, the estrogen over here, this one, the estrogen increases, that increases the blood flow of the capillary in the reproductive tract, okay? And that causes the bleeding. So the bleeding you see or you observe in your dog or different animals actually occurs at the follicular phase rather than the end of luteal phase. That's the difference. So knowing the difference is very important. So in animal, there are many different species. And also there are two different categories of their reproductive tract. One is, we call it polyestrous animals. Okay, in this animal, they have a continuous cycle of their reproductive system. So they have the estrus, ovulation, and after the ovulation, if there's a baby, it will go to the pregnancy. If there's no baby, it will come back to the estrus. This is quite similar like human, polyestrous cycle animal. However, in animal kingdom, there's another type of animal called monoestrous cycle animal. That means what? That means they only have the reproductive cycle once or maximum twice per year. Okay, so they are not like human, like 24 to 35 days per cycle like this every month. They have only once or twice reproductive cycle per year. So they also have the estrous cycle and then ovulation. If they got pregnant, they will continue. If they do not have pregnancy, they will go back to, we call it anestrus. So everything will be quiet. It's quite similar like Dongmian, the hibernation in animal. Okay, but it's just the hibernation of their reproductive system. So in animal, there are these two kinds of differences. So here's a very interesting table I teach for the vet school students. So you can see that these animals are the animals that you probably will encounter quite often. Some of the animals are polyestrous, so they are like human. They have the regular cycle. If there's no pregnancy, they go back to estrus again, like this. Some of the animals, like dog, they are monoestrous, okay? But there are some animals, we call it seasonal. So this is quite different because, as I said, when human beings, they have their period is minimal affected by the environmental factor. However, in animal species, a group of animals, for example, like mare, so horse, the ewe, the sheep, queen, the cat, or rodent species, their estrous cycle is controlled by the season. So they are not, their regular cycle goes together with the season. And that's because of the light. So in those animals, for example, the cat, if you increases or decreases the light, you will induce the estrous cycle. However, I think it's quite different if you shine the flashlight on your girlfriend. Aha, this is going to happen, right? And that's quite different from if you, for example, shine the light on horse, on cat. You will be able to induce the estrous cycle because the estrous cycle goes with the season, goes with the length of light. So this is the recent news. We know that, well, now we have this egg crisis, right? The reason I post this is because, like chicken, increase the light will also increase their egg production, increase their follicle growth, increase their egg production. So after you leave this classroom, don't worry, buy a flashlight and try to go into a poultry farm. Shine the light. We solve the egg crisis. Now, I'm not going to tell you about it. Right. So one of the syndrome that we have to talk about during the period is called PMS, so the premenstrual cycle syndrome. And Professor Ruby will also talk about PMS in detail. But here, what I want to tell you is this PMS, 经前症候群, this PMS is a syndrome. Mostly it's the changes about psychological changes, physiological changes. It's a syndrome. Okay, it's not yet a disorder unless this syndrome, all these, for example, become more anxious. You have the emotional instability. It affects your regular life. If it's not, then these psychological or physiological changes during the period is a normal situation, a normal changes, okay? Then do animals have PMS? Okay, we say because human has period, right? So they have these periods. So then before the period, due to the changes of the hormones, you have the psychological, you have the physiological changes. That's called PMS. But do animals have PMS? The answer is yes and no. The yes is because for non-human primates, those new overall monkeys like chimpanzee, orangutan, gorilla, they do experience this PMS. For example, during their period, they become more anxious, they become more aggressive, and they want to be alone. They don't want to go into the group. That's quite similar like human female during the period. Okay, just leave me alone, otherwise I'll, right? You know, okay? But for the rest of the animal, no, because they don't experience the menstrual cycle. They have this called reproductive cycle, so that's quite different. So then they don't have the PMS. But something happened similar, but we don't call it PMS. So during the reproductive cycle of the animal, there's also behavioral or physical changes on the female animal. For example, you can see over here, during the Astro Cycle, in the reproductive cycle, during the Astro Cycle, their physical activity increases. For example, they walk more, they become more active in person, but they don't want to be alone. They don't want to be in a group. That's for a non-human primate. Here's the table. If you look at in this terminology in details, most of the changes is about they become more anxious. They walk around because it's at their astral cycle, so they would like to find where the male is. So they become more anxious. They walk around and try to see their best man or try to find their best mate. And that's the changes during the astral cycle of most of the non-primates. So most of the mammals besides the primates. And the other behaviors, for example, they become more vocal. They have a specific posture. We call it reproductive posture. Lordosis, this is the terminology saying about this. I think most of you guys or you ladies, when you go to a cat, when you start to pet the cat, especially the lower part of their body, they will start to have these. I always call it outbay. I don't know if I don't know the English term of this, but they will raise their butt. This is the typical or the standard position for mating. This is called lordosis. This happens when animals experience their astral cycle. Okay, but also, for example, here is a pig. So during the astral cycle, if you touch their back, they will just stand still because they thought, oh, the male pig is coming. Now I'm standing for mating. Okay, so like this kind of posture is quite typical for animals during their astral cycle. But you have to remember, astral cycle is very different from the period in human female. Okay, so besides the human or besides the female, okay, the other thing is what I want to talk about the responses of male during the period or during the Astro Cycle. For male during the period, okay, the thing is, don't ask. The best response is don't ask. Okay? Just follow. It's okay. Just a period of time, no? Just eat whatever she likes to eat. Okay. However, in the male animals, besides the primates, okay, we are talking about like dog, cats, horse, or other animal species, non-primate species. There's a very interesting response in male. We call it phlegm response. Okay, so phlegm response is the curly of the upper lip from the male when they sense there's a female in heat around her. So when a male sense there's a female in the Astro Cycle ready to mate, they will have this response. There's a video I'll show you over here. It's a short video. So the phlegm response is like this. What you need to take a close look is the upper lip of this horse, of this pony. Okay, the upper lip. You see that? Cute, no? Okay, there we go again. The upper lip. Hey, that's called phlegm response. That is the typical response for male animal when they sense there's a female in heat ready to mate. Yep. And then the last part of the lecture, I want to talk about the relationship between pregnancy and period. Okay, so as we said, after the ovulation, the rest part of the ovarian tissue become what? Become lutein, corpus luteum, that will secrete progesterone, the hormone, right? So after the ovulation, if there's no pregnancy, so no mating, no pregnancy, it goes in the green track. So when there's no pregnancy, then the uterus will secrete another hormone called PGF2 alpha, so prostaglandin F2 alpha. Okay, this hormone will start to dissolve the corpus luteum. When the corpus luteum becomes smaller and smaller, that means what? That means the progesterone will go down. Okay, when the progesterone goes down, then female knows, oh, there's no pregnancy. I don't need to prepare for pregnant. The reason why endometrium becomes thicker and softer is because they need to prepare for the landing of the embryo. Okay, it's like cushion. No, it's like cushion. Okay, so when there's no need, and it's all controlled by the concentration of the progesterone. When there's no need, progesterone goes down, endometrium falls apart. That's the part when you see the bleeding. And then you have the period. We so-called period. Okay, when you can observe from the periods. However, after ovulation, if there is a pregnancy, so when there's an embryo growing in the female, okay, then the embryo will secrete some proteins to that the mother knows, hey, you are pregnant. You need to prepare a good cushion for me. So then we call it maternal recognition. I'll talk about this. Okay, so embryo will secrete some proteins to tell the female that you are pregnant. So then in this case, it will inhibit the uterus to produce any of the PGF2 alpha. So there's no PGF2 alpha. The progesterone still continue with high level, and that will maintain the endometrium. When it's maintained of the endometrium, then you will not see any bleeding because the endometrium remains, there's no fall parts. Here is one important thing. Whether in human female, whether you will have the bleeding at the reproductive tract all depends on whether you are pregnant or not. Okay? Because, as I said, if after the ovulation, if there's a pregnancy, the embryo will start to move around inside the uterus and will secrete some proteins and cytokines to tell the mother that you are pregnant. So the moving of the embryos inside the uterus, there's an official medical term called embryo uterine migration. Okay, it moves around, it's a physical contact, and also it secretes some proteins, some cytokines. This all allows the embryo mother communication to that the mother knows that you are pregnant. You have to maintain the serum level of progesterone to maintain the thickness of the endometrium to prepare for the pregnancy, so there's no period. So this, I have the unofficial terminology called embryo pachinko. It's moving around the physical contact. We call it 着床前的 pachinko. Yeah, I always tell the vet students about this. It's easy to remember. Okay, so then after the menstrual cycle or the Astro Cycle, okay, in the primates, in humans, okay, so like human female and also the non-human primates, the important thing is that whether you will have the period depends on whether the pregnancy or not. Okay, so over here, including human or non-human primates, if there's no pregnancy, serum progesterone concentration declines after 14 days after ovulation, and then the endometrium falls apart, you will see the bleeding. If the pregnancy occurred, then the secretion of the PGF2 alpha will be stopped. The progesterone will continue at a high level. The endometrium maintains the thickness and hyperemia. Then you will not see any menstrual cycle. However, in most of the non-primate animals, for example, like rabbit, cat, or the cute llama, for example, if there's no pregnancy, serum progesterone also declines at 14 days. However, the endometrium of this animal just becomes thinner and thinner and thinner. There's no sudden fall apart of the endometrium in these animals. So you will not see any bleeding from the reproductive tract. So you are unable to tell. However, if the animal is pregnant, the serum progesterone maintains, the endometrium maintains the thickness and hyperemia. Also, you will not see anything. So the difficult thing for us as a vet is like you will never know. You cannot see from the appearance by whether there's a bleeding or not to tell whether she's pregnant or not pregnant. We have to use other kind of methods to examine the animal to let us know whether the animal is pregnant or not. So this is quite different from human animal. If you have the period, you know that, okay, you are starting a new cycle because you are not pregnant from the previous period. Okay, so that's quite different, I want to tell you. So there are a few take-home messages from this class. The first is, physically speaking, period is a collective end result from a series changes on the endometrium and your physiology. The endometrium becomes thicker, hyperemia. The temperature goes up, and that's all because the influences from the ovary and also the hormone. Okay, and the regular period can be separated into 3 distinct phases: the follicular phase, the ovulation phase, and also the luteal phase. And the follicular phase determines the length of the period. Okay? So the cycle of the period is under the control of hypothalamus, pituitary gland, and also the ovary. So hypothalamus under the midbrain secretes gonadotropin releasing hormone, and then affects the anterior pituitary gland, secretes follicle stimulating hormone that works on ovary to stimulate the growth of the follicles to a certain maturation stage. At the time of the LH peak, that will stimulate ovulation. After the oocyte leave the ovary, the rest of the ovarian tissue become corpus luteum, start to secrete progesterone, and that affects the thickening of the endometrium, prepare the cushion, the sofa, the soft sofa for pregnancy. That's the whole process. So the regular period is about 24 to 35 days, and the amount of the blood, regular blood, is about 1/3 of the Yakult, so it's about 30 ml. Okay, if the amount of bleeding more than 80, you better go to Professor Huang. Okay, she's the doctor for that. Okay, you have to remember. And then the premenstrual cycle syndrome, PMS, is a clinical syndrome. It's a collective term on different changes. For example, you become more anxious or want to cry, or you feel depression. All these different kind of changes, a collective term called premenstrual cycle syndrome. It's a syndrome, it's not a disease, but it can affect your daily life. So it depends on how severe the PMS is. And in animal kingdom, only primates, chimpanzee, orangutan, gorilla, bamboo, this old world monkey has experienced the period. The menstrual cycle in human or primates are very different from the astral cycle for most of the non-primate animals. For most of those non-primate animals, like dog, cats, cow, horse, whatever animals you can think of besides monkey, they do not have the period. They do have reproductive cycle. We call it astral cycle or in heats. Okay? So non-human primates, they do not have the period, so they do not have the PMS. However, during their astral cycle, they become more anxious, more aggressive, because they want to find the best person or the best male to mate. So their physical activity becomes more active. They want to search who is the best candidate for mating. They do not have the PMS, however, they have some specific behaviors. When they sense the male is approaching, they will have the lordorsis, outbay, right? When you touch the cat. So when you leave this class, then try to find a cat to pet their lower part. And when the cat shows the butt or raises the butt, that's called lordorsis. Okay, I want everyone to try that. That's better than you have a flashlight going to the poultry farm. Yeah? Okay. And then in human, the occurrence of the menstrual cycle is highly associated with pregnancy. Okay, so pregnant, yes or not, you will see the bleeding at the end of the period. However, the difficult job for vet like me is that we cannot tell from the appearance. We don't see the bleeding. Yes, we do see the bleeding, but the bleeding occurs during the astral cycle, during the beginning, like follicular phase. Okay, so it's quite different. You have to tell the differences. Yeah. So this is not in the case in the animal. Okay, so this is the part of my lecture for today.